Congenital heart disease, or CHD, is a problem with the heart structure. It is present at birth. CHD affects how blood flows through the heart and out to the body. These defects can be simple or complex. Imagine the heart as a pump. CHD makes the pump work harder. This can cause problems with breathing, growth, and energy levels. The exact causes of CHD are often unknown. However, several factors can play a role. Genetics can increase the risk. If a parent or sibling has CHD, other family members might be more likely to have it too. Sometimes it's just a random change in the baby's genes during pregnancy. Environmental factors during pregnancy can also contribute to CHD. Exposure to certain infections like rubella can harm the developing baby's heart. Some medications taken during pregnancy can also increase the risk. Lifestyle choices are also important. Smoking during pregnancy, for example, can deprive the developing baby of oxygen. This can interfere with normal heart development. It's important to remember that having one or more risk factors doesn't guarantee a child will be born with CHD. Many babies born with CHD have no known risk factors. There are many types of CHD, each affecting the heart differently. Some defects are simple, while others are more complex. A common type is a ventricular septal defect, or VSD. This is a hole in the wall separating the two lower chambers of the heart, the ventricles. Another common type is an atrial septal defect, or ASD. This is a hole in the wall between the two upper chambers of the heart, the atria. Patent ductus arteriosus, or PDA, is another type. It involves a blood vessel that should close after birth but remains open. Some babies are born with a combination of these defects. These are called complex CHDs. Recognizing the symptoms of CHD. The symptoms of CHD can vary greatly. Some babies show signs at birth, while others develop symptoms later in infancy or childhood. Some common signs in babies include a bluish tint to the skin, lips, and fingernails, known as cyanosis. This indicates low oxygen levels in the blood. Babies with CHD might also have difficulty breathing, especially during feeding. They might sweat more than usual, particularly around the head, and tire easily. Poor weight gain is another red flag. In older children and adults, symptoms can include shortness of breath during physical activity. They might also experience fatigue, dizziness, or fainting. Some individuals may not experience symptoms until adulthood. It's important to remember that these symptoms can also indicate other health conditions. Diagnosing congenital heart disease. Diagnosing CHD involves various tests. A doctor will first perform a physical exam. They will listen to the heart and lungs for any abnormal sounds like murmurs. They will also check for other signs like cyanosis. If CHD is suspected, the doctor will likely recommend an echocardiogram. This test uses sound waves to create images of the heart. It shows the heart structure and how the blood flows through it. Other tests might include an electrocardiogram or EKG. This test records the heart's electrical activity. A chest X-ray can show the size and shape of the heart and lungs. In some cases, a cardiac catheterization might be necessary. This procedure involves threading a thin tube through a blood vessel through the groin or arm to the heart. It allows doctors to measure pressures and oxygen levels in the heart chambers. Treatment options for CHD. Treatment for CHD depends on the type and severity of the defect. Some children with mild defects might not require treatment. Their condition might be monitored with regular checkups. Others might need medication to help their heart work more efficiently. For more severe defects, surgery is often necessary. Surgery can repair or close holes in the heart walls. It can also widen narrow valves or arteries. In some cases, a heart transplant might be the best option. Living a full life with CHD. Living with CHD requires ongoing care and management. Regular checkups with a cardiologist are crucial. A healthy lifestyle is essential, including a balanced diet, regular exercise, and adequate sleep. These habits can strengthen the heart and improve overall health. Preventing infections is also vital for those with CHD. They are more susceptible to complications from infections like pneumonia and the flu. Vaccinations and good hygiene practices are essential. Emotional support is crucial for both individuals with CHD and their families. Support groups and counseling can provide a safe space to share experiences, learn coping mechanisms, and connect with others who understand.